Welcome to this week's Health and Care update about the coronavirus pandemic in Devon. While cases have been falling over recent weeks, that rate of decline has slowed up somewhat, and we're still seeing some outbreaks in specific settings such as care homes. I'd like to hand over now to Maria Maloney Lucy, who will give you more information about the data.
This is an overview of the latest national and local data on COVID-19 as of Thursday, the 25th of March. We start with the national picture. Cases continue to fall nationally, but are still above the levels seen last summer and early autumn. The number of tests continue to increase, and deaths continue to fall. Now for the local picture. In Devon, for the latest available week, there were 126 COVID-19 cases and 6 deaths, with rates of both below the national average. Case rates are slightly higher in Eastern and Mid-Devon. Cases of COVID-19 are continuing to fall in Devon, although the rate of decrease has slowed over recent weeks. Case rates are currently highest in those aged 20 to 39 years. The data in this summary is drawn from Devon's COVID-19 dashboard and the National Coronavirus Tracker, where the latest available information can be found.
Next week, we see further restrictions lifted. As of Monday the 29th, up to 6 people or 2 households are able to meet, but only outdoors. Organised outdoor sport and leisure will also be permitted, but please remember you should keep your travel to a minimum. We're all going to have to learn to live safely with COVID for the foreseeable future, and a key part of that is keeping infection rates as low as possible. So please continue to maintain your social distance, wear your face coverings when you're indoors in a public place, and remember to wash your hands frequently and properly. And also, if you're somebody who has to leave home to work or volunteer, or you're a carer for somebody, or you happen to be in a family, a household, or maybe in a bubble with somebody who attends a nursery or education, please access regular testing twice a week. And I'd like to hand over to the NHS Devon colleague, Dr. Paul Johnson.
The number of coronavirus cases and people in hospital with the virus has fallen slightly over the past week and is now the lowest it has been since October last year. And while this is a positive sign, let's continue to be careful by only leaving home if you need to, and if you do go out, maintaining distance from others, wearing a face covering in public places, and washing your hands regularly. More than 600,000 people in Devon have now received a vaccine, including almost everyone over the age of 65. Nationally, there will be a significant reduction in weekly vaccine supply from the 29th of March, which is expected to last for 4 weeks. So no further appointments will be made available on the National Booking Service during April. Between now and then, however, we have plenty of vaccines and there are thousands of appointments available before the end of March. So if you are in the eligible groups, that is, you are over 50 or have an underlying health condition or are a health or care worker and haven't had your first dose of the vaccine, I would encourage you to book an appointment before the end of March. Existing appointments are not being cancelled, so if you already have an appointment over the coming weeks, whether it's for your first or second dose, you should continue to attend as planned. The first dose of both the vaccines offers good level of protection, but to maximise your protection, you will need that second dose. So make sure you attend when you have an appointment booked. And if your second dose is due in April, we will have enough vaccine to make sure you get this. So either keep your appointment if you have one, or your GP practice will be in touch with you to arrange an appointment. We're also contacting a small number of people who are booked to have their vaccine at West Point from the 1st to the 11th of April to bring their appointments forward to March, if at all possible. So our message to you is there are plenty of appointments available between now and the end of March. So if you're in one of the eligible groups, book your slot now. We've seen throughout the pandemic that the virus can and does affect anyone. And the best way to protect yourself and your loved ones is to get the vaccine when you're invited.